Good evening. Today I would like to talk about medieval medicine and some of the misconceptions therein. Now, with the current pandemic situation, I've seen an increase in interest in the history surrounding the plague doctors. Now, I've read a fair few articles, all stating mainly the same sort of thing. One of these shared traits is a condescension towards the historical medical practitioner. The modern scientific mind tends to dismiss the historical surgeon as a charlatan and peddler of snake oil, and tends to dismiss historical medicine as nonsense and quackery. And while it's true that there were a great many snake oil salesmen, and a great deal of historical medicine is nonsense and or quackery, the historical surgeon understood a great deal more than we tend to give him credit for. Just because a modern theory presents a more complete picture of the whole, this does not mean that the historical theory was based on nonsense. Many of them are based on very sound logic. I'd like to demonstrate that in this video. There's a story that I've often heard quoted, wherein a 19th century surgeon discovers that by washing his hands before delivering babies, he can reduce the rate of infant mortality by a significant degree. This led to the development of germ theory, the idea that disease might be spread through means we cannot detect. I've often heard this story misquoted and misrepresented, such that many people believe that it marks the beginning of basic hygiene among the medical practitioners, and that prior to this, the surgeon would go directly from the latrine to the operating theater with manure all over his hands. This is simply not the case. The historical surgeon understood the concept of basic hygiene. I have several pieces of evidence for this. The first is that I've often read that medieval archers during a siege would dip their arrows in manure before loosing them over the walls. Now, if an uneducated peasant archer understood the idea that if you get filth in a wound it will cause disease, don't you think a highly educated surgeon would also? Of course he would, and we have literary proof for this as well. Medical writers, from Richard Wiseman back to the ancient Greeks, advocate bathing the hands in wine before performing surgery. They understood basic hygiene. What they did not understand is the idea that even though your hands can look clean, taste clean, and smell clean, they might not be clean. This brings me to my next talking point, miasma theory. Miasma theory is the theory of disease propagation that predates germ theory. In miasma theory, the idea is that diseases are spread through bad odors. Now, I've often heard miasma theory ridiculed, and on a surface level I suppose it is faintly ridiculous. However, if you examine the logic beneath it, you find that it's quite sound, and it's really the best thing that they could possibly have come up with prior to modern technology. Let's examine the logic. Now, there are several means of disease transmission that are self-evident. There's filth. We find the smell of manure repulsive for a reason. We understand on an instinctual level that manure is not something you want to spend a lot of time around if you value your health. Another self-evident method of disease spread is bodily fluids. If you take the blood, pus, or bile from a diseased man and put it into a healthy man, of course bad things are going to happen. But even to a casual observer, there is clearly more at play here. Sometimes disease will spread between two people who have not had any contact with each other. The only thing they've shared is the air between them. Now come on, how can disease possibly travel through the air? We can see that the air is clear, there's nothing in it. Except wait, there is. I can prove that there is. There must be something in the air because we can smell it. So it must be that thing that's in the air, the smells. Because that's the only thing that these two patients have in common. Now we can laugh at this and call it a simplistic view, but the fact of the matter is that without modern microscopes to prove the existence of germs, germ theory, assuming someone had come up with it back then, would be about as scientific as saying ghosts cause disease. I can prove that there are things in the air. I can smell them. I can't prove there are germs because I can't detect them. The next misconception that I'd like to talk about is the idea that because the historical surgeon did not understand germ theory, that he was therefore unable to prevent disease and unable to treat it. This is simply nonsense. You don't need to understand something to be able to manipulate it. For example, I am using this computer to edit this video. I have no idea how a computer works. When I forge iron, I don't know what temperature the iron is, and I can use a lever to lift a beam without understanding the physics behind it. Likewise, the historical physician, though he may not have understood the core mechanism of disease, was able, at least to some extent, to treat and prevent it. Richard Wiseman, in his 1676 medical treatise, goes into extensive detail about how to treat and prevent infection in wounds, and though in many cases we've come up with better solutions to the same problem, much of what Richard Wiseman wrote still holds true to this day. From the bathing of wounds in strong wine, which we now know to have disinfectant and styptic properties, to the use of herbs, which we now know to have antibacterial properties. The next thing that I'd like to talk about is this outfit as a whole. What it is a full suit of thick leather clothing, designed to protect the wearer not only from the bodily fluids of the diseased, but also to limit the flow of bad air to the surgeon's body. A coat of waxed or greased leather is very good at preventing fluids from getting through, and leather in any form is nearly impervious to airflow. Furthermore, we have the ingenious invention of the plague mask. This creates quite a good seal around the face. Most of the air that I breathe is drawn from a couple of small holes near the tip of the beak. It would then either be filtered through bundles of medicinal herbs, or else through a medicine-soaked cloth that was stuffed into the beak. Now, I've heard over and over again that this sort of outfit would be basically useless in preventing the spread of disease. I disagree in the strongest possible terms. Doctors, in dealing with the current situation, advise everybody to wear masks. Now, if 2 thin layers of polyester are enough to make a difference, wouldn't it also follow that something like this would make a difference? The idea that 2 thin layers of polyester would be more protective than thick leather stuffed with cloth soaked in medicine is frankly absurd. I have a couple of pieces of historical evidence that this outfit worked. The first of these is the sheer amount of leather that an outfit like this consumes. In terms of surface area, leather was quite a bit more pricey than wool, so if you just wanted to look the part, surely you'd have a mask made of felt rather than thick leather. But they didn't. The next piece of evidence I'd like to put forward is the fact that plague doctor suits like this were used for several hundred years. If they were of zero benefit, you'd have come up with something else. The final piece of evidence I'd like to put forward is the simple fact that wearing a mask like this is incredibly inconvenient.
This mask is the most inconvenient thing ever. It's really, really hard to breathe. The air has a lot of struggle getting into the beak. The holes at the tip are very small. It then has to be filtered through 6 inches of cloth that I've stuffed in there.
But there are even more issues.
You can't hear me properly. And the lenses keep clogging up because all my breath is going inside the mask. It's really inconvenient. If this provided no benefit, if I'm just noticing people in these suits dropping dead left and right, I wouldn't bother with it because this is so much of a hassle.
A suit like this impedes your ability to see, breathe, and communicate to a significant degree. If they were without merit, you'd come up with something less inconvenient. Another misconception is the idea that plague doctors were all charlatans seeking to make a quick buck off of everybody else's misfortune. Something that people are forgetting when they say this is that the Black Death killed 2/3 of Europe. Regardless of whether or not these men had proper medical training, it's possible that within their local region there was nobody more qualified still alive. And regardless of any lack of experience, they were still performing a public service at great personal risk. That's quite a brave thing to do. And I think that deserves a little bit of respect rather than scorn and ridicule. The next thing that I'd like to talk about is four humors theory. Now, four humors theory draws a lot of ridicule because, yes, it is fairly ridiculous. For those of you who don't know, four humors theory is the idea that The body's welfare is governed by a balance of 4 bodily fluids: black bile, yellow bile, blood, and pus, and that an excess of one humor leads to various illnesses. Now, we can look at four humors theory with the modern eye and say that it is absolutely categorically false. However, when we examine the logic behind four humors theory, we can see that it is based on a rather sound observation and quite a humble medical perspective. This observation being that the body has built up an excess of one fluid, and that it is trying to get rid of it. When the patient is vomiting, that could be seen as the body trying to get rid of excess bile. If a wound turns into an abscess, this could be seen as the body trying to get rid of pus. Bruising and swelling could be seen as the body trying to get rid of excess blood. In each of these situations, it is to the patient's benefit that the physician try and assist the body in the expulsion of these fluids. If you're vomiting, it's because you have something harmful in your stomach, and there are medications that will aid the body in purging the poison. If you have an abscess forming, it's to your benefit to have it drained quickly before the tissue stretches and tears, leaving a much greater wound. Bloodletting can be used to relieve swelling in infected or bruised tissue, one notable example being in the case of intracranial bleeding, where in the case of head trauma, the blood pressure can build up to the point where the brain is in danger of being crushed in its own fluid. In his surgical treatise, Richard Wiseman describes Mother Nature as being the surgeon, and himself as being merely an assistant. This is quite a humble and refreshing perspective when compared against the modern day. From the way modern physicians talk, you would think that they had forgotten that if the body refuses to heal, there is nothing that the surgeon can do to save the patient. Four humors theory, while being definitively false, encourages quite a healthy perspective on medicine. You are trying to assist the body in its repair, not to overwhelm it with drugs and chemicals. Now, there's a lot more misconceptions that I could talk about. I could talk about the practical benefits of bloodletting. I could talk about why, in historical medicine, amputations were so much more common than they are now. I could talk about this, that, and the other thing. But we've managed to avoid digressions and rambling so far, so I think it's time to call it quits. Anyway, I believe I've said my piece. Thank you for watching. Goodbye.